Hello everyone, my name is Petulia Carson. This video will explain my remote internship at Prevanta Health Solutions. This presentation will consist of the following information. I'm going to discuss a little about myself, how I got the internship, and about the company, and the value of hiring an intern. I will go over the workplace team and collaborators, and I will discuss my internship role and job responsibilities. I will talk a little about the start of day workflow and software used. I'm going to explain several products that I worked on. I will discuss the technical communication concepts and skills that I applied during my internship. Lastly, I will give insight on what I've learned during my internship. I am currently working on a Master of Arts in Professional and Technical Communication and Graduate Certificate in Technical Writing. I plan to graduate from the University of North Texas the summer of 2026. For my undergraduate studies, I earned a Bachelor of Arts in Communication Studies and a Certificate in Professional Communication from the University of Texas at Arlington. How I got the internship. I applied for the internship position on the Indeed job website. I had a virtual interview via Zoom with the supervisor. 1 week later, I had a second interview that also included a marketing team member. Approximately 4 days after the second interview, I received an internship job offer, which I gladly accepted. Prevanta Health Solutions is a global healthcare logistics and solutions company dedicated to bridging the gap between clinical innovation and patient access to healthcare. The value of hiring an intern. It made sense for Prevanta to invest in a technical writer, editor, intern. Healthcare marketing content has to satisfy two audiences at once: clinical decision makers who need precise, credible language, and marketing stakeholders who need the content to be persuasive and on brand. A technical writer is trained to research a subject, verify accuracy, and translate specialized knowledge into audience appropriate language. Exactly the skill set needed to bridge those two demands. Using an intern for this work was also a practical resource and decision. It gave the company dedicated drafting and research hours without pulling senior staff away from client-facing work, while still routing every draft through supervisor and marketing approval before publication. Workplace team collaborators consisted of the technical writer, editor, intern, supervisor, and marketing team. In my role as a technical writer, editor, intern, my primary responsibilities included drafting and editing documents, maintaining accurate and up-to-date database records, and drafting informational content for the company website. I also reviewed and edited existing web pages for grammar, consistency, readability, and adherence to brand voice. And I updated website content to keep it clear, accurate, and aligned with organizational style and messaging. In addition, I responded to website inquiries from potential clients, which meant I had to write in a way that was both professionally consistent and adaptable to each client's specific question. I worked remotely throughout the internship. My supervisor and I held a video meeting every morning via Zoom where we discussed strategies and objectives for the day and week. A member of the marketing department often joined these meetings so that writing, editing, and marketing efforts stayed aligned. Software used. I used Microsoft Word for editing documents, planning, and strategizing. I used Adobe Express to create images. For collaborative work, my supervisor and I would use a shared Word document so that she could see my drafts and edits in real time. My first work product was this banner that introduces the section and states Prevanta's core value proposition in single sentence, combining deep healthcare expertise, with strategic execution to deliver measurable outcomes for partners. The context for this content is that it functions as the section's thesis statement. So every claim made in the 4 cards beneath it has to trace back to the sentence. Getting the single sentence right took several drafts. My supervisor emphasized that it needed to sound confident without sounding like generic marketing language, since healthcare decision makers tend to be skeptical of vague claims. The wording came from a combination of my research into how comparable healthcare market access and logistic companies position themselves, and directives from the supervisor about which of the Prevanta's actual strengths to focus on. Beneath the banner, 4 cards break the value proposition into specific evidence-based differentiators: clinical credibility, ecosystem connectivity, a data-driven approach, and end-to-end partnership. Each card exists to give a skeptical reader a concrete reason to trust the broad claim made in the banner. Clinical credibility and the data-driven approach cards are aimed at clinical and analytical stakeholders who want evidence. So those cards reference health economic models, cost avoidance data, and population health analytics. The process behind these 4 cards followed the shared document review cycle. I drafted each card after researching how language is used across comparable healthcare and health tech company websites. My supervisor and the marketing team member reviewed the draft for accuracy against Prevanta's real capabilities and for consistency with brand voice, and I revised until the language was approved. For research on this kind of content, I used several resources: competitor and peer company websites in healthcare market access and logistics, healthcare industry analytic reports, and public available health economic data sources. Section of the web page needed to explain how Prevanta solutions integrate into a hospital's existing clinical workflow rather than disrupting it. The context for this content is that health systems are cautious about adopting new logistics or technology partners because any disruption to a clinical workflow can affect patient safety and staff time. This card exists because Prevanta needs to reassure health systems decision makers in their own operational language that adoption will be smooth. To draft this content, I researched how hospital integration and clinical adoption are typically discussed in healthcare industry publications and case studies, then verified terminology with my supervisor before drafting. Useful research sources for this kind of content include peer-reviewed healthcare administration journals and hospital association publications, all cross-checked against what our marketing team confirmed as accurate for Prevanta's actual capabilities. Next work product built on the same section, refining the language after my supervisor's review to better match the brand voice and to tighten the connection between clinical adoption and patient access. The process behind this revision illustrates the review workflow described earlier. I drafted based on research. My supervisor added context about how Prevanta's clients actually describe their own pain points, and I revised accordingly before the piece moved to marketing. This repeated process reflects the content lifecycle concepts from content audits and inventories, where content is never simply written once, it is planned, drafted, reviewed against organizational goals, and refined until it earns a place in the published inventory. Now, I will discuss practical applications of technical communication concepts and skills that I learned in technical communication courses and how they were applied during my internship. To ensure I was fully prepared for the demands of this role, I conducted a comprehensive review of learning materials and foundational textbooks from previous technical communication coursework, Specifically, I revisited key insights from Content Audits and Inventories by Paula Land, 2023. This text provided me with the necessary framework to evaluate digital content structures. During the internship, I systematically reviewed existing web pages to catalog content, flag outdated material, and identify gaps, the foundation for the content audit process described by Lamb. Audience analysis. I tailored tone, terminology, and structure for different readers, from clinical stakeholders to patients and the marketing team, ensuring each document met its audience where they were. Plain language and editing for clarity. I edited corporate documents for concision and clarity, cutting jargon and restructuring sentences so complex healthcare information stayed accessible. Document design and formatting. Quality content is essential. I used headings, hierarchy, and consistent layout conventions to make long documents scannable and easy to navigate for busy readers. Content strategy. I collaborated closely with my supervisor and a marketing team member to develop and execute a cohesive content strategy. Together, we identified audience needs, defined documentation priorities, and established a structured workflow that supported both technical accuracy and brand alignment. I contributed by planning content outlines, refining messaging, and ensuring consistency across all deliverables through detailed editing and adherence to style guidelines. Our cross-functional collaboration strengthened the clarity, usability, and impact of the final content. Overall, this strategy improved team efficiency and produced content that better supported organizational goals. What I've learned during my internship. Technical communication skills. I applied technical writing skills in a professional setting, and I applied technical editing skills in a real workplace context. Research skills. Writing accurate healthcare content required me to verify claims against credible sources before drafting, since inaccurate information in healthcare context carries real consequences for patients and providers, not just for brand reputation. Team collaboration. Coordinating with both a supervisor and a marketing team member showed me that technical writing rarely exists in isolation. It is embedded in cross-functional decision making. The importance of daily meetings. Our virtual Zoom meetings with my supervisor and sometimes with a member of the marketing team were not just status updates. They function as a recurring content audit. I was informed about what content existed, what needed revision, and what gaps remain, which showed me how the formal audit and inventory process described in Lamb's content audits and inventories can happen continuously, not only as a scheduled project. Professional growth. I strengthened adaptability and critical thinking skills. I learned to ask questions and seek help when needed. Asking questions or requesting help instead of trying to figure things out alone, which can hinder progress or slow down the workflow. I learned that asking a clarifying question early saved far more time than guessing and having to redo work later. I strengthened my ability to write clear, concise, and user-focused content by working on real workplace materials. Collaborating with my supervisor helped me refine my editing skills. Through feedback, I learned how to revise content based on audience needs, organizational standards, and stakeholder expectations. Working closely with a marketing team member expanded my understanding of how technical content supports broader organizational goals. I gained experience planning content based on user needs, project timelines, and organizational priorities. Thank you for watching.